Congressional Republicans are caught in a traffic jam, a gridlock of their own making on health care reform. The bulk of the caucus in the House, in the middle, the centrists, basically go along with Trump and Ryan's proposal. But on the right, they're concerned that it's going to make the program too expensive and that you have to lower the costs. And on the left, they're concerned that the elimination of restrictions on premiums for seniors could create a situation where the ban on denying coverage because of pre-existing conditions is more apparent than real, because the premiums will go high enough on people with pre-existing conditions that they won't be able to get the insurance. So how do we break that? Well, half of it has already been done. It's what Trump has told the conservatives, which is that he's willing to eliminate that long list of things that must be covered under Obamacare for the policies to be subsidized. And that means if you want bare bones catastrophic insurance, you can get it. If you don't want to pay for substance abuse and mental health and maternity benefits if you're a man, you can do that too. And the conservatives seem happy with that. They haven't signed off on the bill yet, though, because the moderates are raising hell. The moderates, however, are concerned that the changes made in the bill will make it impossible for old people or those with pre-existing conditions to get insurance. See, if the normal marketplace were allowed to develop premiums, older people, 55 to 65, would pay 5 times more than younger people, 18 to 30. But Obamacare limits it to a 3-to-1 ratio. And the new bill eliminates that 3-to-1 ratio and says you can charge what the market price would be. And the moderates are saying, hey, wait a minute, that's going to make it too expensive for old people, and particularly for anybody with a pre-existing condition. So my proposal is that you take the people that are being insured under Obamacare and now under Trump care, and you say, if you have a serious illness, a serious pre-existing condition, and very high medical bills, we will not try to insure you through the normal system. It's too much of a burden on the premiums of the others. What we'll do is carve you out and put you in effect into an assigned risk pool where the government will underwrite your insurance and maybe even put you into Medicare, where the government will pay for all of your health care. Under Medicaid and Medicare and children's health insurance, that already happens. If something is too expensive, the government just pays for it. But under the group that's not covered by any of that, insurance has to cover it, and the premiums have to pay for the care. Well, that purist system needs a little bit of a modification, because it's not designed to handle somebody who has extraordinary health care costs. And those should not try to be paid by raising everybody else's premiums, but rather by special government grants through the Medicare program or outside it to pay for that care. And that way the premiums on everybody else will be reasonable, it'll go through, and it'll work fine. And Trump will get his agenda out from under the logjam that it's now in. Thanks for watching.